I think that self-healing is a verb, and it's where you do something to the body, and that something entices the body to go into self-healing. And after mastectomy, then if we apply the same thinking, then if we do something to the right place and use the right something, then the same thing will happen, that we can entice the body into self-healing. But knowing what to do and where to do it is really hard information to find out. And I'm hoping to share with you some of the things that I've found in my research and my clinical practice over the last couple of decades. So thanks for joining me. My name is Denise Stewart. I'm an occupational therapist, and I've been working in really uncovering the mysteries of self-healing after mastectomy in Brisbane, Australia. Today, we're going to expand on the session that we did last week. So we'll look more closely at the location and the direction of testing, and then we used a gentle contract, relax method to self-heal. And then the second part of this is that I want to show you my second favorite self-healing method. It may be another long session today, but you know, you can take it by bit, or you know, go for a binge and then watch it again. But I think that I'm hoping that if you try this, both techniques, where we're focusing on location and direction, then you will be, maybe a bit as excited as I am. So let's start with the arm to ear test and the reach out the back test, that we worked on last week. But I want to show you a little bit more information. Now, just as a reminder, we looked at why this is an educational session and not an individual advice, and that's because of the many features that can happen or be a consequence of mastectomy, and that each of those features can rate between 1 and 10 for any particular person. I did change the arrows on the left-hand side just because it wasn't quite so clear. And so, for example, skin loss, then which is on the first line, rating between 1 and 10, then the surgery certainly makes it a reduction, so the arrow goes down. If we look at, and don't look at the red bit just yet, the scar response, which is the second line, then the scar response can be up. So in the early phases will be up, and then I know with the right treatment over time, then it can come down. But there's always this underlying up feature, or up gradient, I guess, about the feature of scar response. Now let's look at the red, because that's our focus today. We're going to be focusing on skin movement, which is similar to the other features in that skin movement can go down after the surgery or after radiotherapy, and over time it can, with the right treatment, go up. So go up, yes, that's right, because you know, the more movement it has, then that it's going up, it's improving. The less movement, it's going down. The second area that is in the red that we'll be focusing on today is muscle movement. And so with all those features that you can see on the left-hand side, then it certainly does affect the movement of the muscles. And so when we move, and as we did with the testing last week, then it requires the muscle to move or lengthen to gain that range of movement. And so over time, then that can reduce down, and I know with the right treatments, it can also come back up again. So that means the muscle can move a bit longer. Don't forget, this is not individual advice, that each person will have their own rating between 1 and 10. So let's move on and talk about the muscle movement and length. Now, we looked at this drawing last week, this sketch, and let's look at it in more detail. And so we looked at the movement, which was this is about reach out the back test, and that we looked at the 3 or the 9 o'clock position. And so we require the movement of the muscle or the lengthening of the tissues to be in the horizontal plane, which is these ones here. Now this, I tried to get a sketch with the arm up, but it just doesn't work. So with the arm up, then these tissues here, the line of the muscles becomes more horizontal. And so that's why I call these ones up the top here, which is under the clavicle. There's the sternum, but just underneath the clavicle as horizontal. When we do the other test, which is the 2 o'clock or the 10 o'clock, then it's requiring that these more diagonal fibers of the pec muscle become longer, that they move and become longer. And then when we do the next one, which is the 1 o'clock and the 11 o'clock, and then the 12 o'clock, then it's really testing the vertical fibers. So we need these ones here. You can see that they are already diagonal. When the arm goes up, they become more vertical. We need them to be able to go to their most vertical, to stretch that to their most length, so that we can get that full range of movement. Then if we add in the location of the deep zone for the scar tissue, which I presented last week, which is where the breast tissue was taken away, then that you can see very clearly now that there is it's in the zone of the diagonal and the vertical fibers of the pec muscle. Not so much in the horizontal fibers. But, you know, some people do have surgery that takes some maybe sentinel nodes, or maybe the surgeon does need to go into this section up here. But with mastectomy, it's more in this location. So where the diagonal and the vertical fibers of the muscle are. This is the other sketch that we looked at last week, where pec major is not drawn in, so it's under pec major and it's pec minor. And so if the axillary lymph nodes are dissected, then this is the location for the potential scar tissue. The scar tissue must form there. The question is it between 1 or 10? And it's right on the base of pec minor. And this, when the arm up, is in the vertical direction. The fibers are running more vertically. And so if this scar tissue does interfere with the movement of the muscle, then it's going to change how we easily get, or the amount of movement that we've got in the 1 o'clock or 11 o'clock or 12 o'clock position. Let's have a look at the back. This is a new slide from last week. And so it's clear where we are. That's the spine. This is the left arm and the right arm. This is just a bit more detail underneath. This is underneath the muscles that you see on the left-hand side. But when we go into the arm position of 2 o'clock, 10 o'clock, 1 o'clock, 11 o'clock, and 12 o'clock, it does require that these muscles on the diagonal and then the vertical be able to stretch to their longest. So the muscles need to move into their longest position. And so sometimes people have got a problem in these muscles. And so this is just gives you another idea of another location for our self-healing. So just to take that into our practice from last week. Last week we did our release method, where we went into 3 o'clock or 9 o'clock. And, for those people that were happy enough to try this, then I hope that when you tensioned up gently against that pane of glass, and then counted a quick count of 10, slow count of 5, then relax, then that you actually gain some more movement. And that is because we've talked to the muscle and asked it to relax, and it did. It relaxed a bit more, and it gave us more movement. If we go to the next zones, which is the 2 or the 10, then it's the diagonal fibers and the location in that zone that we looked at, either at the front or the back, that we need to be thinking about for the contract and relax. So if we go, let's just say, to your 2 or 10 o'clock position, and we go to our reach out the back position, and then we tension in, it will be in that, I'll get it right, it's in that, follow that diagonal line. So we're heading in the opposite direction on the clock. And so remember, we're not moving, it's just we think we are. And so we tension up. I'm thinking I'm going that way for a slow count of 5 or a quick count of 10. And it's those fibers that then work more. And then we ask them to relax. And then we see if we can get more stretch. If we got more stretch, then that's because the muscle was a bit tight. It only takes 2 tries at that test, and that you don't change. What I mean by that is that you don't get any more movement. Then it's not the muscle. It's the underlying tightness, the scar, or the adhesions that have reduced the movement of the muscle, and the movement, maybe the movement of the skin, but let's stick to the muscle. And so it's not able to get to its length. So then that's information that goes into your thinking about what you will be working on. So then if we go to the next one up, which is 1 o'clock or 11 o'clock, then it's more about the diagonal but more vertical muscles. So it's these lower pec muscles. And so when you go to contract, then we're going on the opposite way, which if you think about the clock, then we're going to 5 or we're going to 7 o'clock, and we're tensioning up in that direction so that those fibers tension up more, and then we tell them to relax. And the question is, can we go more? If we can't go more, if we can't move more, if the muscle doesn't release, then that means that it's the underlying scar tissue or adhesions that are in that zone that are limiting your movement. So now you can understand a little more about what I'm talking about in terms of location and direction. I'll flick up that slide again just so that it can remind you. It can be in the horizontal fibers of pec muscle, the restriction or the impairment. It can be in the diagonal parts of the muscle, or it can be in the vertical parts of the muscle. And they are very different locations and very different directions. So let's have a look at using the arm to ear test. And I really should have started there, because that's the if you've had a reduction in that arm to ear test, remember that the first one was through the front. If you couldn't get your arm to your ear and you couldn't get it there easily, and the second one was out to the side, arm to the ear, and it was that measure between the arm and ear that you're looking for. So if it wasn't able to get there, then let's think about the direction and then changing our muscle contraction to see if we can make this a better self-healing method. So what I'd like you to do, and I would be thinking in lying on your back, but I'll do it in sitting, and it could be done in sitting. So let's just take test 1, which was arm to the ear out the front. What I would like for you to do is rest your hand onto your head and just see how far you can get your elbow up. So we're just making it just that little bit easier. And remember that the direction that we're wanting the muscles to stretch is vertical in this movement. So arm to the ear is in test 1 is vertical fibers. So what I would like you to do is think about the elbow and ask it to come down in a straight line. And that is not moving. You're using your hand on your head to stop you, and it's a very gentle contraction. So very gently just say, I think I'm going to get that elbow to come down, and count to slow count to 5 or a quick count to 10. And then you say, relax. Once you feel that relax, then see if you can slide the arm just a little bit higher. If you did, it's because the muscles relaxed. If you got no increase in movement, just double check. Do it a second time just so that you can check to see that you did it okay. And so again, if we have a look at it again, so the elbow is coming straight down and you're using your hand against your head, 2, 3, 4, 5, or a quick count of 10. Then tell it to relax, and then see if you can slide your arm back. If there's no movement, then you will be thinking about these vertical, so these long, deep structures, whether it be the skin or the muscle, is the zone that you could be thinking needs some self-healing. The next one we'll do is the test out to the side. So the same thing, let's do the same thing. If you can, then slide your hand onto, or your fingers onto your head. You can get that a little bit further. And then this is a stretch of the, again, vertical. Think about that other chart that I gave you of the back muscles as well. So it could be vertical at the front, or it could be vertical at the back. And so when you then go elbow, go straight down, tensions up, your hand is kind of glued to your head. Then quick count of 10, a slow count of 5, then relax. And then you'll feel that these muscles through here are working. The ones at the back and some of the pecs. It's certainly not these ones. You can actually put your fingers on it. They're not working at all. Then you would see if you can slide it up a little bit more. If the muscle keeps releasing and you get more movement, do it 3 times. I like 3. So that's your test for this week. So if you're happy to investigate that, then use the elbow from the front, the elbow at the side. And then once you've done that, then retest. So go back and check on your arm, the ease of movement, going arm to ear in test 1, test 1, and then test 2, and see if you have gained any range. Just to give you a look at just one of my my patients that I've seen, just to give you an example. If we only look at testing looking at the skin and the muscles without the arm on stretch, then you can look at that that side, the mastectomy side, and it looks soft. It looks it doesn't look taut. So when we put the arm into either the arm to ear test or the reach out the back at 9 o'clock or 10 o'clock, that's when you can start seeing the tightness in the structures. Now you can is hard. This is not a very clear photo, but you can see the tautness in the tissues, and you can see that that there is a difference in the tightness between above the mastectomy line and below the mastectomy line, and that for people that might not know, this is where the pec muscle is here. This structure here is cording. And so in this test then, you can start looking at using your hand in the zone of diagonal, vertical, or horizontal, to start feeling the structures of the skin or under the skin, to see what is pulling tight, what's not moving as well. And to give you another 2 examples of this, for this lady on the left-hand side, then I am trying to move the skin while the arm is raised up, and there is no movement whatsoever there at the skin. The skin is completely stuck to the structures that are underneath, and you can see that I'm well away from the mastectomy line. So it's that zone where the breast tissue was taken. And again, another example of that on the right hand side. And so you can see that the skin and you would have to say and the muscle are stuck in this location, and this being the diagonal, affecting the diagonal movement and the vertical movement. So we can start anticipating that this particular person will have less reach out the back in the left-hand side. Let me go left-hand side on the clock is 2 o'clock or 1 o'clock, and maybe 12 o'clock, because of the scar and the adhesions in that zone, in that location. Now, it's hard to actually say exactly skin and exactly muscle, because in fact all the layers are interconnected. And that if we have a look at this, the diagram below, then, and this is from Anna de Groof, and we'll go into her assessment on one of the blogs in the future. And Anna and many other people know that there is the skin in terms of layers. Then there's the next layers under, which may be breast tissue for some, maybe fat for others. It can be some, maybe the top layer of a muscle, which could be pec major. The next layer down is definitely muscle, and so in the chest wall, then that might be pec minor, which is the one underneath. And then underneath that is is more deep fascia, and then the bones of the ribs. And so there's layers, and these layers are not separate, they're all joined together, they're all linked together. So knowing that they're all joined together, do we work on the skin or the muscles? I would suggest start at the muscles, do your contract and relax, so that you can then rule out muscle tightness. And then the very next thing is skin. So now I would love to introduce you to my next most favorite self-healing method. But before we do that, then I will remind you about the fundamentals of this session, is that it's really about knowing your body better, and that remember that if you have open wounds or that you're early healing, then this might not be the treatment for you. You need to be guided by your therapist, or your doctor, in terms of your exercise regime. This is about remodeling the response of the scar response, and that any of our stretches are taken to the first point of stiff. We're not pushing. And so that our healing, our self-healing, is always a gentle stretch. So let me take you through my second most favorite self-healing method that, that I think is just beautiful to do. It does require you to put your hand on the zone, the location, and use the direction. So now you know what I'm talking about with those words, but what does it feel like? So let's have a look at, first of all, let's not go to the chest. Let's start with somewhere completely different. And if we think about then doing this method only on the skin, how do we know what that feels like? How much pressure do we do for this self-healing? So I will suggest that you use the skin on your eyelid. And so if you then just use that amount of touch that allows you to move the skin across your eyeball, then you know that this is the level of pressure that we'll be using on the skin. And so you can use one finger, you can use 2 fingers, or you can use 3 fingers. They're not pointy fingers. You wouldn't use pointy fingers on the skin. So it's more the flat part of the fingers. And what I would like for you to do is to see how much movement there actually is in the skin going to the outside. So start in one point and then take it to the outside. And you will stop. The skin will only stretch or move so far. But what happens is that it listens to you. It takes its own, it listens and it responds by releasing. And so in this amount of time, which is, I have a magic 10 or 15 seconds, then you can then take that same amount of skin just a little bit further, and I want you to hold it there. Now I measured that, so I went maybe 3 mils. For those in inches, it might have been 2/16 of an inch or 3/16 of an inch. And I'm not pushing at this point, I'm just holding that position of stretch and waited for that magic 10 or 15 seconds, and then see if I can stretch it a little bit further. And yes, I did. I went another 2 mils, 2/16 of an inch. And that's the method that we'll be using. So let's go to another zone. So let's go to the zone, the skin on the forearm. And in this case, we're going to have the elbow bend. So the same pressure that we just used on the skin of the eye, I want you to see what the stretch is in up and down. So wrist to elbow. And then maybe go horizontal to that. And then maybe go diagonal to that. So there'll be 2 diagonals. And that's our skin movement in that area. Now what I'd like you to do is go straight arm, and that I want you to do the same thing. So test wrist to elbow, test across, test diagonal and diagonal. And what you might find is that there's a difference. There's a difference in the amount of movement of the skin. Let's do a treatment. So the treatment is a 3-point treatment, just like we did on the eye. So in the direction, and I think it will be when you have your arms straight is easiest, in the direction where there was less movement. Now, so for me, I've got quite a long scar here from melanoma, and so I had a skin loss. And so that means that my skin movement is reduced as well. And so if I then have less movement going to my wrist, I will hold it at that length. And remember, it's the same pressure as on your eye. And then wait for the magic 10 to 15 seconds. And then see if your body has responded by self-healing. and see if you can glide the skin a little bit more. And you sit at that next level, that next length. For me, I gained about 2 mils. 2 mils, 2/16 of an inch when there is some underlying scar and adhesion is a good gain. So I've sat there for another 15 seconds and then not pushing at all. And now I will say to myself, okay, let's see if I've gained any more movement. And I've glided to the next point. Now, it's really hard to see me gliding because you don't see movement of 2 mils, 2/16 of an inch. So, but you will feel it. So that practice, if you need to practice it again, so it's eyelid going across. You could go into the other direction if you want, but that's not very good for the wrinkles. So I would just go into the outward stretch, and then practice on your forearm in straight. Now, remember that slide with the lady where when she put her arm on stretch that we then saw that things were getting a little bit tight. There wasn't enough movement. Find the position where you can feel that there's some tightness in the location. And remember that it's going to be the direction that we're going to be moving now is in either diagonal or vertical. I would say, let's just start diagonal because that's much easier to do for yourself. Now you could be laying down on the bed. This arm just needs to be in enough of a stretch so that you can feel that tension, that lack of movement in your skin. And then I want you to take that first stretch, so that first point only in the skin. Remember the amount of pressure on the eyeball and the forearm, and hold that position. Now I'm actually using the entire hand. So my fingers are glued to the skin, my palm is glued to the skin. You might find that ditch the clothes and actually get onto the skin. I have been doing this for a long time, so I can work through the clothing. Then you've held that position, that length for 10 to 15 seconds. And then I want you to see if you've got a little bit more. Now you saw that my hand moved in that instance, and I was just taking that same piece of skin a little bit longer, so we've got more skin movement. At this point, I'm holding the line, so hold that length. I'm not pushing, I'm just holding the length and giving ourselves 10 to 15 seconds, and then seeing if we can do it again. On the third one, 3, lucky 3, is enough. Come back to the beginning. And this is where we start measuring. And so remember that, the importance of measuring so that you know that you're doing the right thing. And now look at how much movement you've got in the skin while your arm is in that stretch position. So that is my introduction to you for self-healing. The method is levitt barrier release. Now there may be other names for it, for that same method. This is the method that I've learnt from Professor Karl Levitt from Prague Rehabilitation University some years ago, and I just find that this is a great self-healing method. So thanks for joining me. I've shown you now more about using the muscle energy method in either the reach out the back position or the arm to ear test, and that we're now thinking more about the direction of the muscle fibers that we need for them to get longer. And so by focusing on which direction we're contracting, then we're engaging different muscles. And then secondly, I introduced you to the new method of testing skin and talking to the skin so it becomes more movable, more stretchy, longer. So the challenge this week is to practice, have a go, and then if you're inspired, then you might decide that you would like to take some action, and that would be to get some individual rehab advice. And there's 3 steps that you can take to take that action right now.